Welcome back to the Seed Lab for our 2025 Year in Review episode. Over the past year, we've sat down with some amazing people to discuss how their work brings equity to their workplace and community. Since we last spoke, however, we've seen a shift in service and community needs. Some of these shifts have challenged San Mateo County providers, and in this video, we'll be reviewing some of those challenges, as well as some positive takeaways from this year by asking a few GARE members to share a rose and thorn. We also got to talk to our GARE co-executive sponsor and Deputy Chief of Health, Mark Muehlman, who walked us through the new Targeted Strategies plan. So without further ado, let's get into it.
Yeah, so for the last several years, the department, as well as other departments throughout the county, have had a racial equity action plan. A year ago that we changed the name of it to a social and racial equity action plan. And then this fiscal year, the name for all of the plans for all the departments in the county changed to Targeted Strategies, Improving Outcomes for All. While the names have changed, the focus of the work really is around social equity and racial equity within our organization and for our clients, our patients, our community. And so we continued some of the work that we've been doing for the last few years related to social and racial equity in this year's plan, but we also pivoted and did some changes. That one, we added in a very clear strategy related to social equity on improving collection of sexual orientation and gender identity data, and are doing an assessment, a landscape assessment of kind of what are we doing currently throughout our different divisions and programs, what are the barriers that people are experiencing, what are the opportunities for us. But that is kind of a new strategy and initiative along with some of the racial equity and other social equity work that we've been doing. We've really tried to align the plan that has not just participation, but leadership from our GARE cohort and then our executive leadership working together to try and move these strategies forward, and being able to engage people at all levels across the organization in the work, and also trying to shift how we approach the strategies and the different activities so that they are actionable within the different divisions we have across the department. And so it's a lift that we've been working on for the last several months, and I think we're going to start seeing, as we move into 2026, some real progress.
If you're enjoying this content, get involved. Join us in GARE to be a part of the Targeted Strategies body of work, or if you want to contribute to What the Heck. What the Heck directly contributes to Strategy 4 of the Targeted Strategies mentioned in this video. Health leaders communicate and model commitment to social and racial equity. Reach out to smch_GARE at smcgov.org to get started.
Again, a lot of people don't want to leave the home. A lot of people feel like they're at greater risk of violence, that if they are gender nonconforming, or if they don't pass, or they don't pass yet, or it takes several hours to be more likely to pass, that it's just easier not to go anywhere or do anything. And a real fear that all services will be cut, that it won't just be youth, which of course is terrible in its own, but that adults will also not be able to get their own care.
The challenge I have, I guess I'll just say this is probably a lot of my own lived experience. It could be just I've been doing this work so long that I just feel tired of conversations about equity that don't take bold stances. Like, there's room to take a bold stance and also lift people where they are. Mm-hmm. And I think the stronger position is always the bold position in having different levels of entry, whatever that means, right? Because we know even if we baseline it to the people who don't know or don't want to, they're still not going to come along. I mean, like, not to the degree of the need. And it almost feels, in a personal way, it feels draining.
It is hard work, and you still have people who wants to walk the other way. And so it seems like in one thing you can see both sides of that. I think that the more that we can build community with each other and see each other as full individuals, we will always be making progress if we continue to do that. The work of being able to put together that plan of the targeted strategies is still, we don't know what it's going to bring together in terms of real impact, but just the commitment there to wanting to do that work in the midst of everything that is happening tells me that at the core, people still care. And we're not taking the easy way out of, well, we're not going to talk about this. Maybe when things are better, we can address it. No, we are head on addressing it, and we're willing to put the work, and we know that that's the work. That to me is a rose.
So I'll say a rose would be thinking about how we came up with the new targeted strategies plan. Is that we have one, and I feel like there's conversations at multiple levels about coordinating accomplishment of the different work plans for those strategies. And I think there was a good bit of conversation around how there's intersections, and we can see how it's really one body of work. That would be sort of my rose, is that we had a process that felt more coordinated, and it feels like there's a working body to move progress and to monitor progress on how quickly we move forward.
I saw something recently that was talking about how the United States and many people in it who do great work seem really down on themselves right now. And that they can see that, but they're like, but it's possible that the United States is doing something in a couple of months or years that takes some places multiple generations to do, which is to fight off fascism. So much depends on what happens here, but if this turns out that it mobilizes people, that it teaches some people that there is a difference between different things, that it reminds people of the importance of some things, that it lets everybody remember that your political voting isn't a love letter, but it's a chess move, all of those things, it's possible that there are good aspects to this, and that there's more strength going on here than I think we can always see.
For me, the rose is, in the midst of all of that, how we as peers, co-workers, as an organization, come together in spite of. So it's really our people. In the tougher times, you see who you really are when you look in the mirror. You see who your coworkers really are. And we have in this department just some really spectacular, wonderful, passionate, committed public servants. And you see that more in the trying times. And that is something that kind of keeps giving me hope, and keeps me getting up and wanting to come in and do the work and help move things forward, because of the really great people that we have and how we come together.